Hi folks, back again, Bathrobe Chronicles, and this is going to be a kind of, oops, lost my mic, unusual evening. This is sort of a special edition. I'm not going to put any numbers or tags or any of that stuff on it. And what I want to do, and I'm not really sure why I'm doing this, is I'm going to make some tapes for the new people, if you will, at emergency services in Norfolk, Virginia, and that's what this is. And if you're a new person and you actually see that I'm doing this, I'm grandiose at times, but I'll guarantee you one thing: if you are new and you watch all these tapes, you will learn something. To back up for 1 second, I spent over an hour the other day taping 5 of these, and it's the first time it's ever happened. The videos were rolling around in the frame. I'd never seen that before, and so now I'm doing it all again. I've got a bunch of notes, and nothing really is in order, so it may be disjointed, I may be jumping around. That's the way it is. The other thing, I hope that since you are, assuming that anyone is watching this, if you are a new employee, I assume you know some of the basics, the criteria, and all of that. On the off chance that some folks who stop by my channel are watching this, I'm going to make this so that even a new person who has never been in emergency services will have some idea of what's going on. I'm surely not going to have somebody stop by and wonder what the hell I'm doing without giving them enough information to have some idea of what your job is. So, that being said, real briefly, not that it's that important, but I worked in emergency services for about 18 years, 14 and a half or so in Norfolk, and then a few years in another city. But things in Norfolk have definitely changed. I know that. When I was first introduced, if you will, to emergency services back many years ago, at that time, it was basically impossible to get a job in emergency services. I mean, absolutely impossible. People went there and they stayed forever. When I was hired in Norfolk, I felt almost blessed, if you will. No, not that kind of blessed, but blessed, if you will. There were, I think, 70-some applications for one job. Now, I'm not grandiose enough to think that they picked me first, but I was the one who was hired out of 70-some applications, I believe. And you know, people went to emergency services because that's what they wanted to do, or at least thought they wanted to do. And once they got there, they stayed, and that was it. No telling what's happening with you guys now. I think you're like in and out the door in a couple of days or something, but that's neither here nor there. For the folks who are stopping by and who are not these new people that this is directed to, the short version is emergency service workers, their primary job in the state of Virginia is to do evaluations and determine if someone meets the criteria to be hospitalized psychiatrically against their will. That's the primary function, and it's what's called a state-mandated service. The other things, they do crisis counseling and things like that, and try and get people in rehab places and crisis stabilization places and so forth and so on. So emergency services, they're the folks who are called by the police department, the emergency rooms, citizens, jails, schools, you name it, and emergency services gets called. Now, as I said, I'm going to be jumping around. I do actually have notes, but they aren't in order, and that's just the way it is. But as I said, if you're a new person, I can guarantee you will learn something. You know, and I'm sure you're getting training of some type, you know, and all of that. Also, when I refer to them and they, I'm referring to the supervisors, the team leaders, and all those other people, you know, up at the top, so to speak. I will try, well, anyway. Now, here's one thing I want to stress. The day you walk out the door on this job, you're going to start setting up your reputation. In other words, how you deal with the emergency room docs, the nurses, the secretaries even, for crying out loud, in the emergency room, police officers, the paramedics, people at the schools, and also the families of the mentally ill and the mentally ill themselves. How you conduct yourself is going to set up your reputation. And believe me, it's really important that you have a good relationship with all the local hospitals. If you don't, you've had the weenie. And one thing you don't do is you don't fudge. And some of you out there, when I say some, I'm talking universally, do fudge. And they withhold facts, and they do other kinds of things. And if you're that kind of person, well, you shouldn't be doing the job anyway. By the way, I can basically say what I want because this is my tape. But anyway, in all seriousness, when you walk out the door, you're going to be setting the stage for what people think of you in the community, in the hospitals, and everywhere else. So watch yourselves. And if you're brand new, you don't know anything. So remember that. And how can you know anything? You just started. So there you go. Now, let's see, what else here? The main thing to keep in mind is normally if you're like called to a scene where the police are, the paramedics or whatever, or called by a family member or something like that, normally you're going to be asked to determine whether or not someone meets the criteria. And more or less what the criteria is, this is for the other people, I surely hope you guys know, is because of mental illness, dangerous to self or others, or because of mental illness, substantially unable to care for themselves. And that's primarily what you're going to be doing. Once you decide whether or not you're going to detain, then you get into the other options of trying to have someone admitted to crisis stabilization or detox or what have you. But you need to keep coming back to what the criteria is and whether or not the person meets the criteria. And frankly, and most likely 90% of the evaluations you do, you should have a pretty darn good idea within a couple of minutes. You don't need to go through these like 99-page evaluations. Now obviously when you sit down to write this thing up, it's something else. But what I'm talking about is you should have a pretty darn good idea of what's going on within 10 minutes at the most. For most of the folks, the seriously mentally ill folks. The other important thing is you must stay in control, no matter what. When you walk out the door, you start on your reputation, and when you get to a scene, you must maintain control. And sometimes it's fairly chaotic. You'll have police officers, 2 or 3 of those, family members yelling and screaming, and on and on and on. But you got to maintain control. And if you don't, somebody's going to take the control away from you. It's rare, but sometimes the police, get involved and start asking questions, and you need to squelch that as soon as it starts. And now you have to work with the cops, assuming you guys are going to be there very long, which I would imagine some of you aren't. But anyway, that's neither here nor there. And if a police officer starts asking questions, you just say, hey, officer, gosh, I really appreciate your help. Let me finish my evaluation, then I'll be happy to let you, talk to the person or whatever. So, regardless of who gets in there, you have to maintain control. And if it is real chaotic, you might say to the officer, gosh, officer, would you mind escorting Mrs. Jones or whomever, the mom or the boyfriend or the girlfriend or whatever, out so that I can talk to, Peggy Sue here, the person I'm supposed to be evaluating. But as I said, the 2 things, your reputation, but when you're out there doing these evaluations, you need to maintain control. The other thing is, in 18 years, and I'll try not to repeat that again, other than the seriously mentally ill who maybe would kill themselves through accident or something, I've never had anyone who I evaluated and let go who killed themselves. Now maybe they did months, or whatever, but I'm talking about short term. More or less, the people who you see are not going to kill themselves. More or less, most likely 60 or 70% are going to tell you they are going to kill themselves. you have to make your own decisions out there, obviously. But basically the people who you will be seeing most of the time, not all the time, most of the time are not people who are going to kill themselves, regardless of what they say. It's just not going to happen. The other thing to remember is it's always easier just to go out there and detain everybody. Or if you go to the emergency room, let them languish in the emergency room for 2 or 3 days while you try to find them a bed somewhere, or crisis stabilization or whatever. That's the easy way to do it. If you want to take the easy way, just go detain everybody. It's no big deal. Let's see, what else do I have here? I got lots of stuff, really. Now, when I first started, boy, I know you guys have that new deal where you have to be certified, watch movies and all that. And I don't know what the training is like there now. But, and by the way, I quit November of 2010. Just a wretched place. Sorry, shouldn't have said that. Anyway, but when I started, I basically had almost no experience in mental health of any kind. It's a real long story. I won't bore you with that. I watched 3 evaluations, and then I was on the street. There were 2 people who I watched do evaluations. One of them told me we, meaning emergency services workers, were more like detectives than anything else. We're trying to find out what the heck's going on, because you get conflicting stories. The other one told me if it's a substance abuser, I'm using that in a nice way, instead of crackhead or drunk, don't believe anything they say. Now, both of those things actually have some merit to remember them. One thing is trying to discover what the truth is when you start getting conflicting testimonies from people. By the way, I'm a little hoarse, I apologize. Let's see, what else do I have here? As I said, I'm just running through these things here, and there's no organization. Also, there's a saying, if you haven't heard it, I'll give it to you. It ain't against the law to be crazy. Just because someone is mentally ill doesn't mean they need to be locked up and forced into a hospital, or even encouraged to go to a hospital. As I said, it ain't against the law to be mentally ill. You got to keep coming back to the criteria. Are they meeting the criteria, and are they refusing voluntary admission? That's what you need to keep coming back to. Sadly, a lot of people have fixed delusions, and these are delusions that they're going to have no matter what happens, no matter how much medication you give them, no matter how much talk therapy, for lack of a better word, you give them. They're going to have these delusions. They're going to go on and on and on forever. And a lot of these folks, if you stay there long enough, you'll see time and time again. That doesn't mean that they shouldn't be detained at some point. But here again, you shouldn't be detaining somebody who has a fixed delusion. It ain't going away. It's just not going away. That in and of itself shouldn't be a reason to detain someone. Not taking medication is not a reason to detain someone, just because they're not taking medication. There's got to be some other stuff going on. Supposedly, you guys are supposed to be doing the least restrictive. So I guess most of the new people are just jamming up the old ERs. And there's no rule that says you can't street someone. Now, you guys are in a different position than I was in, because I bailed out because of the pending, if you will, Norfolk General business, where you guys have been pimped out by Norfolk Community Services Board to Norfolk General. And I don't care what any of them say, or what legal weaseling they have gone through, that violates the code of not having a financial interest and not being an employee of the facility where you detain someone. I'm not even going to argue the point. It's right there for anyone to see. I don't know how they got around that. But hey, weasels are weasels, and that's the way it is. Let's see, what else here do we have? Yeah, as I was saying, it's real easy to detain people. But if you're actually serving the citizens who supposedly you're supposed to be serving, that's oftentimes is not going to help them. and I'll give you some of my experiences. I had a lady one night who everybody said she had to be detained. She took an overdose. Her son was in the Air Force stationed in California. She called him, police came, packaged her up, took her to the ER. She tried to bolt from the ER, you know, wearing a gown with no underwear. And boy, by the time I got there, everybody, you know, said, hey, you got to detain her, you got to detain her. The short version is I didn't. And the reason I didn't is, number one, it wouldn't have helped her, it wouldn't have done a damn thing. It would have just ticked her off. She didn't believe in psychiatrists or psychiatric hospitals or any of that kind of mess. What I did get her to do was guarantee me she would see a counselor twice. She didn't want to, but she said she would. And oftentimes, you can look at someone and say, you know, are you an honorable person? Will you do what you say? And which I said, and you know what the lady said to me? The only thing I have left is my honor and my word. But the point I'm trying to make is, even if everybody is saying somebody needs to be detained, that may not be the case. Especially in the ER, because the ER docs will say to you, gosh, I don't feel comfortable discharging this person. And as a buddy of mine, who also quit, would say to them, it's not a comfortable business. And it's really not. And I know I'm repeating myself a lot, but it's real simple just to go out there, you know, like some automaton or robot or whatever term you want to use, and just detain everybody. You aren't doing anybody any good. It's a lot easier, of course, but whatever. 99% or so of the cops out there who you will do business with, 95% at least, are pretty darn good folks. And but occasionally you get into a situation where they aren't going to cooperate, meaning they aren't going to do what you want them to do. Oh, Lord. Back in the days when you could hold someone 4 hours, I hope you know now that you can get a 2-hour extension. I had this fellow who definitely needed to be in the hospital. I was with him 4 hours. I called every hospital up to Fredericksburg. No beds anywhere. So I wanted to get him to the ER. 4 hours were up. And that's another thing you can do. And as I said, this is disjointed. When you get out there and you think it's going to be a lengthy kind of thing with no beds, ask the officers, what time did you arrive on the scene? So at least you'll have some idea of what you're looking at in terms of the 4 hours or the 2-hour extension. But anyway, so this night, I went and, when the 4 hours was up, I went and said to the fellow, hey, Mr. Jones, you know, we're real concerned about you. We'd like to get you to the ER, at least have you checked out your blood pressure and stuff like that. Would you have any objection? He says, no. So I went and asked the cop to take him to the hospital. And oftentimes, they'll say, we're in our taxi service. Oh, I can't do that. I need papers, blah, 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 blah. Well, none of that's true. They can basically do what the heck they want. So this particular evening, I said, look, Officer so-and-so, and I scribbled his name down. I said, I'm not trying to tell you what to do or what not to do. Here's what I'm telling you. I have a person who I'm documenting is mentally ill, needs to be in a hospital, and I'm going to document that you, Officer Jones, refused to take him to the emergency room. Hey, I'm not telling you what to do. I'm just telling you what I'm doing. So, of course, he got on the phone, called the supervisor, and, you know, boom, the guy was at the emergency room. But the thing is, if somebody, you know, you're supposed to be out there doing what's right for the citizens. You know, and I'm not riding a white horse, and no, I don't have a white hat. So, let's see here. What else do I have? I'm sure, I hope you know, if you've been out there 30 seconds, that sometimes you just need to get somebody to the ER to get them medically cleared no matter what. I hope you know a little bit about that. The hospitals will always tell you. And the code does allow the police to take someone to the emergency room. That is allowed in the code. Now, sometimes you'll have to, you know, fist fight with them, but that is allowed, no matter what. They'll normally call their supervisor, blah, 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 you know. When you're interviewing elderly folks with dementia, well, most people have dementia are elderly, not all, but most. You know, don't aggravate them. They're confused enough as it is. So take it easy on them, you know. And the so-called mental status exam, you know, oh, what day is it, and all that kind of crap. Modify that a little bit. You know, you can find out about people without going into all of that. And when you get right down to it, is it really important if someone knows what day it is? Think about that for a minute. How important is that? You know, there are some people who are homeless, they don't work. Why should they or even care about what day it is? So, you know, don't go up and say, oh gosh, you know, what day is it, who's the president, and all that kind of crap. Some people don't care who the president is. You know, try and do something a little better than that. You know, when I first started, I remember I would occasionally ask what day it is. I didn't do that for long because it's pretty meaningless. But one night it was kind of funny. I said to the lady, "Gosh, you know what's the date of today?" or something like that. She said the 12th or something. I said, "Boy, you're close." And the cop looked at me and said, "George, it is the 12th." So, who knows? Who knows? Who knows? And when you start an interview, you know, I remember there was one person who I worked with, and I hope she stopped doing this, but she would say things like, "Hi, I'm here to do a psychiatric evaluation." Terrific. That's a good way to develop some rapport. It's real simple. If you're out on the street or something, you can say, "Gosh, Miss Jones, what happened tonight? All the police officers are here. What's going on?" You know, and sort of go from there. If you go to an ER, "Hey, Mr. Jones, what's going on? What brings you to the hospital?" Real simple. It's not complicated, you know? It really isn't. Let's see. If you go to the ER, of course, have them print you out a chart so you'll have some idea of what's going on, and talk to the attending nurse. Hey, you know, what happened to Johnny? Anything unusual? Whatever. And if necessary, you know, say hi to the doctor or whatever. Once you're sort of known, if you last long enough to become sort of known, you know, when you come into the ER, always wave to the doc, at least let him know you're there, or pass by and say, "Hey, I'm here to see Johnny Jones," or whatever. But talk to, and at that time, if they have an opinion, they'll give it to you. But check with the charge nurse, see what the person's been up to, and have the chart printed out, because you're going to need that no matter what to do your blue form and things like that. When you talk to people about hearing voices, don't say, "Oh gosh, Johnny, are you hearing voices?" Anyway, with that, I'm at 20 minutes. I'm going to stop and start again. I'll be right back, and we were talking about voices.